Hello, my name is Kelsey Davis. I am a student at the University of New England, and welcome to my presentation on obesity among Mexican American children in El Paso, Texas. Obesity is a major epidemic in the United States as rates continue to increase across the nation. At the very basic level, when we look at obesity, it is categorized as a disorder. Which involves excessive body fat, and we measure that by body mass index, which if it is greater than or equal to 30, the individual is considered obese. Now, obesity increases the risk of a variety of health problems, including type 2 diabetes, mental health complications, cardiovascular disease, chronic kidney disease, some cancer, and musculoskeletal disorders. It is important to note that currently the rates of obesity are highest among non-Hispanic Black adults and Hispanic adults. However, obesity affects a variety of populations for a variety of different reasons. Childhood obesity is also a major issue in this country. The prevalence of childhood obesity reached 19.7% in 2020, affecting about 14.7 million children. Childhood obesity increases the likelihood of transitioning into adulthood with obesity and in turn facing poor health outcomes. It is also important to note that low-income families are disproportionately affected by obesity. Now moving on to El Paso, Texas, shown in the photo to the right, El Paso sits on the border of the United States and Mexico. 82.9% of El Paso residents are Hispanic. This population has lower rates of health insurance, lower income, and levels of education, and higher rates of food insecurity. In El Paso, Texas, the rates of childhood obesity are particularly high, as the 2021 census data indicates that 26.9% of children in El Paso, Texas live in poverty. Now, while obesity is a preventable condition, families in El Paso face a variety of barriers that prevent the adoption of healthy habits. There are a range of economic, racial, environmental, and social factors that put this population at high risk for obesity. Health determinants within the Latino population are often due to socioeconomic status, but other barriers for this population, specifically in El Paso, include low health literacy, poorly built health environments, and lack of insurance coverage. Food insecurity among this population is also particularly high, often due to affordability, but also the food-built environment. Many children and their families live over a mile from supermarkets or grocery stores, and that limits the access to fresh, healthy, affordable food, which is essential not only for just proper nutrition, but growth and development in children. Families that can't access these grocery stores, whether it's affordability or distance or just lack of transportation in general, they aren't able to provide healthy food options for kids. And so we turn to consume foods that are energy dense, very high in calorie, and have limited vitamins and minerals from either grocery convenience stores or fast food outlets. So when it comes to potential interventions, I think it's important to zoom out and look at the bigger picture. Of course, it is important to teach our children the importance of proper nutrition and exercise, and encourage those behaviors and create opportunities for more nutrition education and exercise. But when families are lacking healthcare coverage, facing language barriers in healthcare facilities, and lacking knowledge on how the healthcare system in this country works, the children of El Paso are not going to receive the proper care that they need to adopt these healthy habits. So I would present the health literacy intervention. Health literacy is defined as the possession of literacy skills, so that's reading and writing, which is typically in English in the United States, and the ability to perform knowledge-based literacy tasks that are required to make health-related decisions in a variety of different environments, whether that's the home, the community, or health clinics, hospitals, etc. So improving health literacy among adults and children allows them to then make informed decisions and educated decisions for their own well-being. So this intervention would be a series of information sessions that can be offered every 3 months in person and virtually in both English and Spanish to fit the circumstances of different families. Using a baseline survey and a survey post-intervention would allow us to evaluate the results and effects of this intervention. The content would include health safety information, common medical terms, basic nutrition education, and a breakdown of resources available for families and children in El Paso and how to access them, whether that needs to be broken down by the resources that each individual family has access to, sitting in front of a computer and showing them exactly how to access these resources could make a major difference in getting the food and healthy resources that they need. In turn, the hope is that this new information sparks behavior change among Mexican American families to implement healthy habits, but also access the resources that they need to control weight status. This intervention would be a partnership with the El Paso Department of Public Health led by Angela Mora. The hope is that this would breach the gap between the community and the section of government that aims and promises to improve the health of its members. Thank you.